Hello, and welcome to another episode of I Didn't Know That, the show that may make you say, I didn't know that. I'm your host, Chad Hale, Clinical Director for Pathways Community Mental Health. On today's show, we'll be discussing the golden thread of clinical documentation. What is the golden thread? Well, in short, it's the concept that documentation is all linked together, as though there is a thread connecting one document to another and binding them as one. It is golden because it's valuable. It has worth. It matters. Too often, clinicians see documentation only as paperwork that has to be completed. In so doing, they may miss the importance of what it represents and what its function is supposed to be. In actuality, our documentation is extremely important for multiple reasons. First and foremost, it tells the story of treatment. The clinical record should be able to tell the reader many things. The primary reasons a person is in treatment, what conditions are influencing their functioning, what are the person's goals for improvement, what is the plan to assist them, and whether progress is being made. While doing so, it should also be clear what treatment providers are doing, why they are doing it, and how they are doing it. The concepts of the golden thread support the connections between documents. It also overlaps or parallels with the clinical practices that are occurring. We are required to conduct a comprehensive assessment of the person served at least once per year. The results of that assessment are then documented within the biopsychosocial assessment, or the BPS. That assessment must minimally identify whether the individual meets criteria for services due to a qualifying diagnosis, which results in a substantial limitation in their life. Once that has been determined, additional needs, symptoms, and concerns are also to be identified and documented. This starts the thread, connecting then to the professional recommendations that are made to address the qualifying condition and associated limitations. Next, using a person-centered planning approach, a plan of service is developed. The thread continues from the BPS to the plan, tying the limitations, needs, concerns with the professional recommendations. Out of the needs and limitations, goals and objectives are created. Based upon the needs and concerns identified within the BPS, and because of the thread, the focus of the goals and objectives should not be a surprise. Instead, they should logically flow out of the identified areas of concerns. Goals and objectives should point us in the direction of improving those situations, recovery from conditions, and focus on personal growth that will diminish the impact that diagnosis or condition is having on the person's life. The goals are identified in order to set the direction that the plan will take, to tell us what we are working towards. From there, the thread connects to the objectives, which are smaller, measurable steps that will show us whether or not we are making progress towards the identified goal. Next, the thread connects to the methods of intervention. These are the steps that we and others will take to support the completion of the objective, which in turn will result in meeting the goal. Next, the services are identified. The services are the vehicle in which the methods are used to support meeting the objectives, which support meeting the goal. And they are all connected via the golden thread. After assessing for eligibility and needs, and planning for what to work on and how to do so, next we provide a service in which we put to use our methods. That service is then documented in a progress note of one kind or another. The note spells out what we did, how we delivered the service, and which goals and objectives were the focus of the service. The golden thread continues its link, connecting the goals and objectives to the methods used within the services as it is documented within the progress note. When a service has been delivered, the content of the note and the description of what we did should clearly describe the service that we are documenting having completed. Every plan of service must be reviewed for effectiveness. This must happen at least once within the time of the plan, but can happen with greater frequency. When we review the plan, each goal and objective must be commented on. We should be addressing what progress has been made or not made. When a lack of progress is noted, then we should be addressing what we believe has hindered progress and what changes should or could be made in order to address those barriers. Likewise, if progress has been made and goals and objectives have been met, then comment on next steps should also be included. It is not enough to simply review the goals and objectives. If progress or lack of progress indicates the need to make changes in interventions, services, and or intensity of supports, then those things should be commented on. Having assessed, planned, initiated services, and reviewed the plan's effectiveness, the golden thread eventually ties us to the next assessment, with progress notes and periodic reviews filling in the gap between each assessment and plan. The golden thread ties together the story of the person's care. All pieces of documentation are connected because of it. Together, the information should explain everything that is going on within that care. As mentioned before, this parallels with the clinical processes that should be occurring. We should be providing a formal comprehensive assessment at least annually, developing a plan of service based upon identified needs and clinical recommendations, delivering the services identified in the plan of service, and using interventions consistent with the service being provided, and reviewing the progress or lack thereof, and making adjustments to services and interventions accordingly. Thank you for your time and attention. If you have any questions about this topic or would like to learn more, please contact me and I'll be happy to help you. In addition, if you have suggestions for future topics, please pass them along to me. In the meantime, I encourage you to be curious and ask the hows and the whys of what we do so that you may know more. After all, knowing is half the battle. Until next time.